The media briefing, which involved other government stakeholders such as the Minister of Health, National Drug Law Enforcement Agency, and police, was meant to address the current speed of crime and substance abuse in the country. Authorities used the occasion to outline measures taken by the government to allay criminal activity and drug abuse, especially prevalent among the youth population. The Director General of the National Drug Law Enforcement Agency, Bakari Gassama, said the Gambia is mainly used as a transit and storage point for hard drug peddlers, while reacting to the recent emergence of kush and other psychoactive drugs.
We have seen the emergence of new psychoactive substances like kush, ecstasy, and other substances that are new in the market. And their potency is very high. Of recent, we've realized, the Ministry of Health have realized the admission of patients who develop serious health complications. And during engagement with them, they were able to realize that or confess that they use kush with other chemical components.
Gassama further underscored the untiring efforts of his in the fight against drug abuse and trafficking.
We want to inform the public that we are determined, to curb drug situation in this country, by enforcing all the laws, going after perpetrators, arresting them, investigating and prosecuting them.
The Assistant Inspector General of Crime Management Coordinator Landin Bojang countered reports of significant crime, saying the Gambia is listed among the countries registering the least crime rates within the sub-region.
As far as we are concerned, if you go by record, the crime rate is not as high. Gambia is among the least countries registered in crime rate. It depends on how it is reported. But it's not that how it's happening. And if we come to crime, the patrols are 24 hours on. Both the police, both the military, the National Drug Enforcement.
Bojang urged the public to desist from concealing information relating to criminal activities within their neighborhoods, stating that all should join hands to mitigate crime in the Gambia.
Gambians, people need to change their attitudes. Because crime is at the doorstep of everybody. Every Gambian here, crime is at your doorstep. And people are not coming out with information. If you conceal a crime at your doorsteps and it's happening, if you are secure, but remember, your next neighbor is affected and you are keeping quiet with it.
Commenting on the health implication of the kush substance, the Deputy Director of Health Services at the Minister of Health, Momodu T. Nyasi, provided data on the suspected number of persons admitted at hospitals in relation to kush abuse.
As a ministry, currently from 25th of January to date, we have registered more than 25 cases and 2 brought in death in both our teaching hospital and other health facilities, all suspected to have consumed this substance known as kush, and some others call it ginabas. It is a public health concern. It's a state concern. That is why the state asks us to come together and see how to work together to make sure that we solve this problem.
Nyasi also revealed the health implications related to the abuse of the harmful substance.
This substance, once consumed, it does not only affect your physical well-being, it affects your mental health. And if you are not lucky, it can lead to death.
Kush, as it is locally called, is a drug made out of human bones, rolled up and smoked like a cigarette. After a few puffs, the user is totally knocked out and unable to function, as seen in several near-fatal cases reported in different parts of the metropolis. Babou Cham, GRTS News.